जेके न्यूज़ टुडे के सभी व्यूअर्स का एक बार फिर से स्वागत है आपकी खातिर सीरीज़ में। जैसा कि आप जानते हैं कि आपकी खातिर सीरीज़ जेके न्यूज़ टुडे का एक कम्युनिटी वेलनेस इनिशिएटिव है। तो इसी को आगे लेके जाते हुए आज हम एक बहुत ही इम्पॉर्टेंट और सेंसिटिव टॉपिक के बारे में बात करेंगे, जो कि इनफर्टिलिटी। इनफर्टिलिटी एक ऐसा इशू है जो आजकल कपल्स के बीच में बहुत कॉमन हो गया है, बहुत स्ट्रेसफुल इवेंट बन गया है, इतना तक कि कपल्स कई बार अपने होप बिल्कुल गिव अप कर देते हैं। तो इस इशू के बारे में बात करने के लिए हमारे साथ एक स्पेशल गेस्ट जुड़ी हैं, जो कि बहुत ही रिनाउंड रिप्यूटेड गायनेकोलॉजिस्ट हैं, डॉक्टर सपना खुल्लर। मैम, वेलकम टू जेके न्यूज़।
थैंक यू फॉर कॉलिंग मी।
मैं आपसे सबसे पहले ये पूछना चाहूँगी कि ये जो इनफर्टिलिटी का इशू है, ये आजकल ही क्यों सबसे ज़्यादा पाया जाता है? जैसे पहले होता था इन 80s और 90s बहुत ज़्यादा बच्चे होते थे लोगों के, बट नाउ व्हाई वी आर फेसिंग दिस इशू ऑफ इनफर्टिलिटी?
सी, इनफर्टिलिटी हैज़ बिकम वेरी कॉमन नाउ। इनिशियली आपको इतने पेशेंट्स नहीं मिलते थे इनफर्टिलिटी के, लेकिन आजकल बिकॉज पीपल आर गेटिंग मैरिड लेट, दे आर वेरी करियर कॉन्शियस, गर्ल्स आर गेटिंग मैरिड लेट, तो उस चक्कर में उनकी जब शादी लेट हुई तो उसके बाद प्रेगनेंसी में इश्यूज आ जाते हैं। बिकॉज अकॉर्डिंग टू आवर बुक्स द बेस्ट एज फॉर हैविंग अ चाइल्ड इज़ बिटवीन 20 to 30 एंड नाउ पीपल आर गेटिंग मैरिड एट 30. So that is one issue. And even I have seen in my practice that male infertility has become very common. पहले तो हमें मेल इनफर्टिलिटी का कोई लो स्पर्म काउंट का पेशेंट मिलता ही नहीं था, लेकिन आज तो इतने पेशेंट्स हैं जिनका स्पर्म काउंट इज़ लो, देयर इज़ ओलिगोस्पर्मिया, एज़ोस्पर्मिया, maybe because of some lifestyle disorder, maybe because of radiations, mobiles, don't know.
तो मैम, जैसे पहले होता था, व्हेन आई वाज आल्सो प्रैक्टिसिंग विद यू, तो हमें ऐसा लगता था, कहीं ना कहीं कस्टम था, सोसाइटी में टैबू माना जाता था कि अगर इनफर्टिलिटी है तो फीमेल को ही ब्लेम करना है। तो मैम, अब ये मिथ आप कैसे ब्रेक करेंगे?
देखो, ऐसे है कि जो फीमेल्स मोस्टली पहले जो केसेस होते थे फीमेल्स में ज़्यादा, हमें जैसा लाइक आई टोल्ड यू, मेल्स वर नॉट सो मच इन्वॉल्व इन इनफर्टिलिटी। लेकिन आज जो है कि जब हमारे पास कोई भी कपल आता है, इनिशियल टीचिंग वाज आफ्टर 1 year वी यूज़ टू डू टेस्टिंग फॉर मेल्स, बट आज हम इनिशियली जब फर्स्ट विजिट में ही हम मेल का सीमन एनालिसिस करा लेते हैं। सो इट इज़ इक्वल 50% chances of infertility because of female factor and 50% because of male factor. So both have to be treated and this myth has to go, because mostly एक हमारा जो बड़े लोग हैं उनको यही लगता है कि it's always the female because of whom नहीं हो रही है, but the younger people are changing because they are more informed.
तो मैम ने ये मिथ काफ़ी अच्छे से ब्रेक की है कि सिर्फ फीमेल्स को ही नहीं हम रिस्पॉन्सिबल ठहराएं फॉर इनफर्टिलिटी। देयर आर वेरियस फैक्टर्स, इवन अ मेल कैन बी इनफर्टाइल। मैम, गिवन द सर्कमस्टांसेस कि इनफर्टिलिटी बढ़ती जा रही है एंड यू हैव अ वास्ट प्रैक्टिस, आपका इतने ज़्यादा, यू आर सो रिनाउंड, सो रिप्यूटेड, इतना आपका बाकी डोमेन्स में प्रैक्टिस रहा है in terms of painless deliveries, urinary stress incontinence. So what made you switch to this line and specialization of infertility? Thoda ma'am light, can you throw some light on this?
This is a very, very important, very nice question, because whole of life when we were practicing, we were mostly into urogynecology, gynae cancer surgery and all types of gynecological problems. But in my practice, I was just observing that once I came in one media show also, and there were patients who were calling me, and I was thinking that they will call me about some surgical problems, and I was surprised. Most of the people were calling me for infertility. Then I realized the number of patients of infertility has drastically increased, and so many patients in Jammu now, they are going out. They were going out for treatment. So which I felt, why should our patients go out? Why should they not be given full complete treatment with world class labs here in Jammu? So that set me thinking, and then I ventured into infertility.
दैट्स ग्रेट मैम। मैम, एक और मैं चीज़ यहाँ पे पूछना चाहूँगी कि ये सारा प्रोसीजर एक प्रोटोकॉल के हिसाब से चलता है। देयर इज़ अ प्रोटोकॉल, सेट प्रोटोकॉल दैट हैज़ टू बी फॉलोड, स्पेसिफिक इंजेक्शंस दिए जाते हैं। तो इसमें मैम बहुत सारे कपल्स को लगता है कि बड़ा मिथ है कि स्ट्रेसफुल इवेंट है, बहुत ज़्यादा उनको ऑर्डील झेलनी पड़ेगी, बार बार जाना पड़ेगा। सो मैम, हाउ यू हैव मेड थिंग्स ईजियर एंड डिफरेंट इन योर प्रैक्टिस?
IVF today is a very simple procedure. There is no admission, There is no surgery, there are no cuts, there is nothing. It's a simple OPD procedure. Patient जब आते हैं, because I will like to explain how it happens. Like, see, this is the uterus, and these are the tubes, and this is the ovary. Normally what happens कि ovary से egg release होता है, it goes into the tubes, husband semen enters, and then there is fertilization. If because of any factor, that there is tubal block, or there is some male factor infertility, or some problem in the uterus, this simple process is not occurring. So what we do in IVF, we do in vitro fertilization, that is fertilization outside the body. So what we do is we stimulate the ovary. For that we give injections to the lady, because we want maximum number of eggs to come out, and for that we give some injections, which is very simple, 5-minute job. Patient comes to us, and then we give injection and they go home, and simultaneously we keep on doing ultrasonography, and once we are satisfied that good number of eggs are there, we take the eggs out with the help of ultrasound, and we take the husband sample. The fertilization which normally had to occur here, that we do outside, and this fertilized embryo is then transferred into the uterus. So it's very simple.
So very simple, and a very happy message for those couples जो infertility से जूझ रहे हैं कि आपको hopeless होने की ज़रूरत नहीं है. You can still have a child अगर आपको infertility की problem है. मैम, मैंने ऐसा पढ़ा है और बहुत देखा है कि जो ग्रीन कोट IVF सेंटर है, उसके बच्चे जगह टाउन्स में हैं जम्मू कश्मीर के. तो मैम, what is the success rate?
See, our success rate is, our motto is everyone deserves one of their own, and we strive our best कि जो भी हमारे पास आए उसको हम बेबी दे के भेजें. So success rate normally with our modern procedures like ICSI, freezing, freeze-all cycles, blast transfers, so it is about 65 to 70%. But when we repeat the cycle, sometimes if there is a failure, there is nothing to feel very sad and forlorn about it, because we can always repeat, because we always freeze the oocytes and we freeze the embryos, and if we'll put them again, so almost about 85-90% patients will conceive. So there is nothing to feel very sad and depressed कि क्या होगा, it has not happened. You can always repeat it, and first time success rate is about 60 to 70%. It's quite good.
That's really nice, मैम. एक तो ये चीज़ आज आपने बहुत अच्छी बताई कि बार बार स्टिमुलेशन की ज़रूरत नहीं है एग्स की. वी कैन फ्रीज एग्स एट दैट पॉइंट ऑफ टाइम ऑल्सो. मैम, एक बहुत ज़्यादा रहता है फीमेल्स को कि जब वो IVF के लिए जाती हैं कि हेवी डोजेस ऑफ हार्मोन्स दिए जाते हैं, दे माइट गेन लॉट ऑफ वेट, और फिर प्री प्रेगनेंसी रेस्टोरेशन ऑफ फिगर इज़ अ बिग चैलेंज फॉर देम. सो मैम, व्हाट आर योर सजेशंस एंड व्हाट वुड यू लाइक टू एडवाइस टू सच women?
See, first most important thing is counseling. Their mental makeup has to be very, very positive. They should not think कि क्या होगा, कैसे होगा, because now we have flexible dosing schedules, which is very, very simple, just 11 days of injections. Earlier when we had long cycles, we used to give injections from the 21st day of the previous cycle. Now it is not there. Hardly you give injections for 10-11 days, so it's not much, and it's OPD procedure. You stay in your own house, you don't need to go out. You just come to the clinic, you get your injection and go back, which is quite simple. And weight gain, it's like in any other pregnancy. You can always come back to your normal shape after it's all over. You see the whole of Bollywood going for IVF. So they're all in shape.
So ma'am, can we say that pre-IVF counseling is helpful in breaking?
Very, very important, because after we do IVF, it's very important for us. We always tell the patient that they have to be relaxed, there has to be no physical stress, and there has to be no emotional stress. For that, we should prepare the patients beforehand so that they take it easy. I always tell the patients, once we've done the transfer, you have some Netflix or something, and you just watch movies, relax yourself. Eating is also, no restrictions, not much. So you can do your normal thing, and after 3-4 days, only 2-3 days rest. And after that, you can do your normal thing. Most of my patients, they are teachers, doctors, so they keep on doing their job. So that's not a problem.
तो मैम, हम कह सकते हैं कि पेशेंट्स बहुत जल्दी मोबाइल हो सकते हैं, एम्बुलेटरी हो सकते हैं, उनको ज़रूरत नहीं है बेड रेस्ट की. सो दिस इज़ अनदर गुड थिंग. एक और आपने मिथ ब्रेक की. मैम, इनफर्टिलिटी की बात की जाए तो आपने PCOD की भी बात की थी. सो व्हाट रोल PCOD हैज़ प्लेड इन इनफर्टिलिटी, और बहुत ज़्यादा मैम बढ़ती जा रही है, तो प्लीज़ मैम इस पे थोड़ी सी रोशनी डालिए.
PCOD is like an epidemic. Say, because you'll see young girls, all of them are worried. Maybe because they're eating a lot outside, and as I always say, this PCOD is a disease of the gut. It's not a disease of the ovaries. Though ovaries are affected, but initial problem starts in the gut. There is a inflammatory reaction, there is insulinism, hyperinsulinism, and because of that there is so much hormonal imbalance. And once that hormonal imbalance sets in, there is a vicious cycle, there is obesity, and then on, and then ultimately leads to infertility. So if we do the right treatment at the right time and weight reduction plus some little treatment, there is nothing to lose hope and despair. Patients can be treated without any problem.
मैम जब हम प्रैक्टिस करते थे और आप एकदम देख के बता देते थे कि ये पीसीओडी का पेशेंट है, तो कई बार बहुत ज़्यादा कॉस्मेटिकली लड़कियां डिप्रेस्ड हो जाती हैं. देयर इज़ हिरसूटिज्म एंड ऑल्सो मैम व्हाट डू यू सजेस्ट फॉर दैट हिरसूटिज्म, एक्ने, ये जो प्रॉब्लम आती है कॉस्मेटिक?
See, that is there, that age is there, and you are really worried what is happening and all, because their mothers never had so much hair and why it's happening to us. So basically you tell them that first they have to change their dietary habits, they have to reduce weight, go more for keto type of diet, and decrease the carbohydrate intake. And for hirsutism and all that cosmetic treatments, initially they have to go for that, and then once the whole hormonal milieu is corrected, PCO gets corrected, then this doesn't recur.
मैम एक और चीज़ मेरे माइंड में यहाँ पे आती है कि इनफर्टिलिटी का क्या हमारे लाइफस्टाइल से, जो आपने कहा कि लाइफस्टाइल डिसऑर्डर्स हैं काफ़ी ज़्यादा, सो एनी पर्टिकुलर डाइट यू वुड लाइक टू एडवाइस टू सच पेशेंट्स जो कि इनफर्टिलिटी जिनको डायग्नोज होती है?
See, the diet as such, PCO patients definitely we tell them a particular diet, but otherwise, see, there are so many causes of infertility. Maybe tubes are blocked, or she has endometriosis, or it is a male factor infertility, or it is a tuberculosis, whatever, depending on the cause. So their diet doesn't play so much role. Supposing already the patient has tubal block, then there is, and I always tell patients one thing: please, if you have any tubal blockage, please don't keep on going for this tubal recanalization, and because it is a damaged tube. The damaged tube will never get repaired and you will never have a baby. And at the same time, till you are wasting your time for surgeries and all, even endometriosis patients, what happens is the ovarian reserve, it further goes down, and you really waste that precious time, when your reserve was good, when you could get your own eggs. So then you could get your own baby. So don't waste the time. If you have any such kind of a condition where IVF is the only answer, just go for it. Don't waste time.
सो स्पेशल मैसेज फॉर आवर व्यूअर्स कि जो प्रेशियस टाइम है वो वेस्ट ना करें. अगर ऐसा उनको प्रॉब्लम लगता है, इमीडिएटली दे शुड सीक मेडिकल कंसल्टेशन. एक मैम बहुत फैशन में आ गया, सेलिब्रिटीज़ अपने एग्स फ्रीज करवाते हैं. सो आई थिंक इवन दैट्स वन ऑफ देयर मेथड कि वो फ्यूचर में व्हेनेवर दे वांट टू बी प्रिपेयर्ड फॉर पेरेंटहुड. वन
this freezing of eggs, we have this facility in our center, which is very important, because there are some girls who have endometriosis. They're still young, they're still not married, so later on they'll get married, and by the time they are married, their ovarian reserve is totally go. So I always advise them, you get your eggs frozen. Oocyte freezing can be done, and then they can concentrate on their care. Even for cancer patients, so before they go for chemotherapy, they should get there. I have few patients where even semen we have frozen for some young boys where they had to undergo chemotherapy. So I think that is actually a boon.
So freezing of eggs and sperms is actually a boon. डॉक्टर सपना का ये कहना है कि no matter आप किस एज पे शादी करते हैं, you can all still pursue your career no matter what kind of stresses you are facing because of infertility. So you needn't lose hope. You still can have a happy family with happy children. मैम वन मोर थिंग, मैंने देखा है कि ये जो IVF के थ्रू बच्चे होते हैं, these babies are exceptionally cute and good looking. So मैम, what would you like to say on that?
एक तो हमें ये बच्चे लगते ही क्यूट है, because they are our own babies. We develop so much love for them, but definitely they are very cute, because maybe I've observed that probably they go through the culture media, and probably because of that they are all very good looking and cute babies.
सो मैम आई हैव सीन ये ग्रीन कोट के जो बेबीज़ हैं आईवीएफ सेंटर के कितने स्कूल्स में आई थिंक जा रहे हैं अब एंड यू फील सो प्राउड ऑफ इट एंड इंडीड आई हैव वर्क विद यू आई हैव सीन कि आपने डिफरेंट फेजेस पे डिफरेंट डोमेन्स लिए, आपने यूरिनरी इनकॉन्टिनेंस पे काम किया, यू वर्कड ऑन पीसीओडी एंड अदर सर्जरीज एंड अब आईवीएफ के जो मैम आपका डोमेन है, आपने जब शुरू किया कुछ तो मैम चैलेंजेस आए होंगे बिकॉज वेन एवर यू स्टार्ट समथिंग न्यू तो चैलेंजेस तो आते हैं. सो व्हाट वर द चैलेंजेस यू फेस्ड?
Challenges initially, of course, you slowly had to make sure yourself really expert and fine tune your method so that you can. Basic thing in IVF is giving results. You may do anything, you may do any kind of advertisements, that is not going to help you. You have to give results because patients want only results, and that is what I was focusing on. And of course your lab had to be really good, that with all the facilities, all the modern facilities. And thirdly, to change the mindset of people, because 5-6 years back you had to convince people that this is, you can go, you should go for it. But now people are very much accepting this method, and because they are well read, they go through the net and they are half informed when they come to us.
That's really nice मैम. बट कई बार मैंने भी देखा है बिकॉज आई एम फ्रॉम कम्युनिटी मेडिसिन. कई बार लोगों में अभी भी लगता है कि जो घर के बुज़ुर्ग होते हैं इतने रिसेप्टिव नहीं होते और अभी भी जो उनका वो देसी इलाज चलता रहता है. प्रॉब्ली आई थिंक वो एक चैलेंज आपको लगा होगा.
That is definitely there because वो हमारा जो एक सोशल, बट आई टेल देम कि साइमल्टेनियसली आपने कहीं नहाना है, कोई धागा डालना है, यू कीप ऑन डूइंग, आई एम नॉट स्टॉपिंग यू, बट डोंट स्टॉप योर ट्रीटमेंट, द मेडिकल ट्रीटमेंट, बिकॉज this window of fertility is very very short for a woman. For a male it's not a problem, even at 60 they'll have, or 55 50 they'll have good sperm count, but females the quality and quantity of eggs is drastically goes down after 40. So don't waste that time. And of course the old ladies at home, there that you very rightly said that you have to convince them because they always say abhi aap chote ho, abhi baad mein karna, and then by the time patients come it's sort of late.
कि पहले होता था फॉर इनफर्टिलिटी ट्रीटमेंट पीपल हैड टू स्पेंड सो मच. उनको लगता था कि जम्मू में हमारे लिए कुछ भी नहीं है, वो दिल्ली भाग रहे हैं, चंडीगढ़ भाग रहे हैं. बट नाउ आई रियली वांट टू से दिस थिंग एंड एंडोर्स दिस थिंग कि जितना सक्सेस रेट ग्रीन कोट आईवीएफ सेंटर का है, सो दे कैन हैव एवरीथिंग अंडर वन रूफ इन देयर ओन टाउन. तो मैम वो जो पहले ऑर्डील थी आपने भी देखा होगा, व्हाट वाज दैट कि लोग बाहर क्यों जाते थे?
See, वो mindset था कि वहाँ better treatment होगा, but then slowly, this is what you were saying, ना, what challenges came. Then we treated those patients who were IVF failures outside, 6 IVF failures. I have done cases, 5 IVF failures in really reputed centers, and when we gave them pregnancy, so from word of mouth it spread that they're doing good work.
So ma'am, hard work pays, and here I would also like to say that Dr. Sapna's domain is just not in infertility, but ma'am ne urogynecology mein I think she has worked wonders. So ma'am, before we wrap up the show, what is your carry home message for all the couples and especially to the women of reproductive age?
I tell them that being modern, it's very important that you concentrate on your career, but I think family life is also important. Little focus on that also, but if you are more towards career, I think then go for freezing of eggs. And second thing is, there is no need for anybody in Jammu to go out. Everything is available in Jammu under one roof. We can help you.